You know, when you go to the grocery store, you can see the price of milk on the shelf, you see it when you check out at the cashier, and you see it on the receipt when you go out. But that's not possible in healthcare.
Giving patients access to hospital prices is why healthcare advocate Mary Beth Garino wrote the Post the Price report. She says patients should be able to get an accurate look at what the price of care is before they see a doctor.
Patients, as consumers, have a lot of power over purse strings and the power of a consumer to decide where to spend their healthcare dollars. But they can't do that if they don't know the price.
Since 2021, federal rules from the Centers for Medicare and Medicaid Services, or CMS, require hospitals to make their prices public in two ways: in a machine-readable file for researchers and in a consumer-friendly format as a price estimator. How does it look at 3 years after that?
It's iffy, honestly. We expected to be able to compare prices that were reliable, and unfortunately, there were some hospitals that still weren't even providing prices for procedures that we know they offer.
Garino and her team at the U.S. Public Interest Research Group, or PIRG, looked at prices for a knee replacement surgery at 27 hospitals in the Cleveland, Ohio metro area.
And we found a huge variation in prices when it came to the cash price, and a smaller but still significant variation when it came to the insured price.
Some only had downloads of complicated files you'd need a special program to read.
Our national investigative team did our own analysis on hospital prices, spending months trying to find price information at 74 of the nation's largest hospitals. Of those, 77% had a tool designed to help patients determine hospital cost, as well as a comprehensive price list.
So there has been improvement. And I think that the updates to the rule this past December will help as well. But I think now we need to focus on the reliability of the information, not just the access to it.
As far as what patients can do to help themselves, Garino says if you're paying through cash or without insurance, there's a requirement called a good faith estimate. If your final bill is $400 or more than your estimate, you're entitled to dispute it. You can also ask your insurance company how much the procedure will cost you out of pocket.
I think the more that we use these tools, the more that we ask hospitals for prices, the more likely we are to move closer to accurate prices.
With this Watching Your Wallet, I'm Caresse Jackman.